to their chest, they're not going to be able to get a breath in. So everybody try this exercise for yourself. Take your chin, tuck it all the way to your chest, and take a really deep breath. Now take your chin and point it all the way to the ceiling and take a really deep breath. Which was easier for you?
Yeah.
So when they're laying down, and you know how sometimes when dogs are injured, they pull down. If they're pulling down, you're going to have to manipulate that head up to a neutral position. So you just want to pull it up so that nose is pointed, so that it's up a little bit. When we do that, we pull the tongue off the back of the throat and we open up that airway. The same with people. So just remember that for yourself. If you're down here and you're trying to take a big breath, it's not going to be as effective as if we take that airway and we just manipulate it up just a little bit so that we can pull that tongue off the back of the throat. When we bring up that airway, we want to check for breathing. You know, you can kind of get down and look and listen, or I tell people, you just place your hand right on their chest while you're holding that open. You should be able to feel your chest, your hand move. I do that a lot when I work with preemie babies, because it's really hard to see their chest move because they really breathe from their belly. So I always put my hands on little babies, and that's how I assess breathing, because when your hands move, you know, it works great with dogs. You always want to try to get right there under the corner of your elbow, right at their rib cage, because you're going to feel that expansion really good there. Even if they're breathing very shallow, small, shallow breaths, you're still going to be able to feel it. And it's always good, too. You know, I kind of look and listen. Do I hear anything coming out there? Do I feel any breath? So we want to assess that breathing for about 3 to 5 seconds. You know, count out your 3 Mississippi, 4 Mississippi, 5 Mississippi, because sometimes opening the airway is all that you need for them to take a big breath. And at that point, you just need to maintain this open airway and get them to the vet. At that point, you've got things going.